An unlikely partnership between two longtime rivals could help improve EMS service in the Portland area.
Ambulance services, over the years have been built on competition. You compete against other private services for 911 contracts and even some non-emergency contracts. But things have changed significantly. The environment has changed, conditions have changed. And if we as healthcare providers, as EMS providers, don't respond to those changing times, then we're not doing our job.
Larry Boxman is the vice president of Metro West Ambulance, based in Hillsborough. For years, his company has competed with AMR for county contracts. In August, Washington County switched from Metro West to AMR, pushing Metro West to primarily non-emergency transport, like taking patients from the hospital to their homes. Now, just 5 months later, they're back in the 911 game in Washington County, all because AMR asked for help.
It doesn't solve all the problems, but it's a piece of a solution. So it's helping.
Randy Lauer leads AMR, the primary ambulance provider in Washington, Multnomah, Clackamas, and Clark County. To fill staffing gaps, Lauer turned to Metro West.
The level of cooperation and their willingness to support and to recognize this crisis has been very helpful, and we're very thankful.
Metro West runs one unit in Clackamas County, but the subcontracting is really being used in Washington County. When AMR gets down to 3 or fewer available ambulances in the county, they call in Metro West to take calls. Boxman said Metro West crews were activated 162 times in its first month of subcontracting.
So this partnership with AMR and Metro West, do you view that as something that's sustainable long-term?
Yes, that really is a system.
Lauer says Washington County's staffing levels and response times are now improving. It's Multnomah County that has a more serious problem.
In, I think, October, we were down 50 paramedics. Now we're close. I think we're 59 or 60. So it's still going the wrong way.
Multnomah County officials and AMR have clashed over how to solve its ambulance problem. The county fined AMR $500,000 for late responses. AMR says it can't fix the problem as long as the county requires 2 paramedics on each ambulance, a requirement not found in neighboring counties. County Chair Jessica Vega Peterson has repeatedly listed subcontracting as a potential solution. Lauer says he'd like to subcontract to Multnomah County, but there's a catch.
Could Metro West come into Multnomah County and help out?
No, because that ordinance, ambulance service area plan, only allows it with fire.
AMR points to this section in the ambulance service plan, saying it may subcontract with established fire departments or districts within the area. And when AMR checked with fire agencies, they don't have the staff to help. The plan doesn't explicitly say anything about other private providers. Vega Peterson disagrees with AMR's reading of the contract that it can only partner with fire agencies, saying in a statement, "I'm in full support of Multnomah County and AMR exploring and evaluating any subcontracting, mutual aid, or partnership that could assist in increasing AMR's performance within the county. The current contract does not preclude contracting with other providers." Meanwhile, Lauer says if the county changed the contract to explicitly say AMR can work with other private providers, it would do that.
Is that something that can be modified to say, hey, if another ambulance provider could help us out, fill a little staffing here, we'd be interested in that?
Sure, absolutely, yeah. Anything that'll help staffing, anything that'll put one more ambulance on the street every day. I mean, we're looking for wins as small as that, just one more ambulance. We'd like to have about 20 more, but every one helps.
And for what it's worth, Metro West would be happy to fill in.
If asked, would you be interested in subcontracting or helping out in Multnomah County?
Yes, we would. If we were asked, we would do whatever we can to help Multnomah County in whatever capacity they request.
Of course, Metro West has the most to gain by expanding subcontracting. But with industry staffing shortages and frequent cases of unavailable ambulances, Boxman believes it's the way forward.
We could take our resources combined with AMR resources and provide a much better level of coverage than we can as any single provider. The ultimate benefit is to the community members because they don't have to worry, is an ambulance going to be available?